Hello everyone, this is Dr. Anvita Chaubey, an obstetrician and gynecologist from Approx Clinic Silchar. As we all know, the month of November is a prematurity awareness month, so I am here today to highlight few important points on preterm delivery or preterm birth. Now to start with, what is preterm birth? Any birth which occurs before 37 completed weeks of pregnancy is called preterm birth. It may be either early preterm birth or late preterm birth. The early preterm birth is those births which occur before 34 weeks of pregnancy. Now, India ranks number 1 in the prevalence of preterm deliveries across the globe. Approximately 1 out of every 10 babies born in India are preterm. Now, what causes preterm birth? There are certain factors which predisposes a woman to go into preterm labor or to give birth to a preterm baby. The most important being is a prior history of preterm delivery. The other factors which predisposes a woman to go into preterm delivery are like if the woman had undergone some kind of a cervical surgery in the past, or she had like number of DNCs for mid-trimester abortions, and like some other factors if the gap between two pregnancies is less than 18 months, or if the woman is either underweight or overweight, if the woman smokes, like if she is a chronic smoker, if she has some chronic medical conditions such as diabetes mellitus and high BP which is not yet controlled, if she has some kind of infections which may be either during pregnancy or even before pregnancy, such as some kind of genital tract infections or UTIs, etc. So these are some other factors, like if the woman has a short cervix which is evident in sonography. So these are some of the factors which predisposes a woman to go into preterm delivery. The most concerning feature of these preterm deliveries is that the newborn, the preterm newborn which is born is more likely to have some short-term and long-term complications. The most important short-term complication being RDS, which is also called respiratory distress syndrome, in which the baby faces some difficulty in breathing, which is due to his immature lungs. Other short-term complications can be like he may have some feeding problems or vision problems, and he may be a low birth weight baby. He may also have some long-term complications which includes cerebral palsy. He may be having some learning disabilities and maybe have some behavioral changes. So now the question is, can we prevent preterm deliveries? Now clinically speaking, it's not possible to prevent all the preterm deliveries, but yes, there are certain strategies or like interventions which we can do to prevent some of the preterm labor. Now here comes the role of preconceptional counseling. Now, what is preconceptional counseling? This is when a woman who is planning to conceive pays a visit to her gynecologist to get herself checked whether she is in a perfect condition to get pregnant or not. Now, the things which we look for in a preconceptional counseling is that is the woman underweight or overweight. If she is underweight, we'll advise her to gain some weight, and if she is overweight, we'll advise her to lose some weight, as both of these underweight and overweight women are predisposed to getting into preterm labor. Number 2 is if she is a chronic smoker, we'll advise her to quit smoking. And number 3 is if she has some chronic medical conditions such as uncontrolled diabetes mellitus or uncontrolled blood pressure, we'll first ask her to normalize them before getting pregnant. Then we'll look for some nutritional deficiencies such as folic acid deficiency, iron deficiency, calcium, magnesium deficiency, as all these deficiency predisposes a woman to get into preterm labor. We'll correct them before advising her to get pregnant. Also, we'll look for birth spacing, that is there should be a minimum of at least 2 to 3 years gap between two pregnancies. And the last one is if the patient had a prior history of preterm delivery. In those patients, we usually monitor them with a serial ultrasound starting at the gestational age of 16 weeks, and we look for the cervical length. If the cervical length is less than 2.5 centimeter, in those patients we usually start them on vaginal progesterone, which is micronized natural progesterones. And some patients who are not a candidate of progesterone, or those patients who have a dilated cervix on a sonography, in those patients we do a surgery which is called cervical cerclage, in which we usually stitch the cervix so that preterm labor is prevented. So by adopting these few preventive measures, we can try to reduce the burden of preterm deliveries in India. That's it. Thank you.